From Dr. Mike, what does MU? Am I saying it the right way, Dr. Mike? Is it mu?
Not moo, mu.
Oh,
Mu.
Mu.
Gotcha.
What is it?
Mu. Greek letters. Mu.
Mu.
Right. It's a variant, and it's in every state in the United States but Nebraska so far. The good news is it makes up less than 1% of the cases. So we're dealing with the Delta variant.
Okay.
I'm tired of the Delta variant. Everyone else is. And so this mu variant is a variant of interest, meaning they're watching it and they're seeing if the mutations make it more transmissible, make it less likely to be affected by antibodies, whether it be monoclonal antibodies or vaccines. We just have to watch and wait.
Yeah.
Another reason to get vaccinated and wear masks.
But also, on top of those questions, those are important ones, is it worse than the Delta variant? Do we have enough information on that yet? The symptoms and what it does to you?
Not yet. Not yet.
Okay.
It's not that common.
Okay.
Originated, I think, in Colombia, but
Okay.
we're
But of course,
watching it.
I feel like that's how it always starts with the Delta. Oh, it's not that common. Then it becomes common, so you want to hear. But I guess we'll learn
Exactly
more
what
as
happened,
it goes.
yeah. All right, back to school this week. I know what you're going to say. You got to wear a mask.
I heard some of the sound bites that you were playing. Look, you have to wear a mask. This is a respiratory virus. And I'm all about personal freedoms, but the bottom line is if your kid doesn't wear a mask and they have COVID, and by the way, numbers are skyrocketing in kids, then it puts everyone else at risk.
Yeah, for
So
sure.
it's not a personal decision. It's an everybody decision. So what has Dr. Fauci said to protect your kids? Because many of them under 12 are not vaccinated. So they wear a mask, they avoid large crowds, and everyone around them that is eligible to get vaccinated should get vaccinated. There you
But
go.
here's the
And
thing
we're going to
that
get boosters soon.
I'm sure
Yeah.
some folks who are hearing, we should get vaccinated, it'll help us, whatever. But then you think of LaSalle and what's going on there. 85% of the folks at LaSalle are vaccinated, yet they're still having the shutdown. So what do you say to some folks saying, well, it doesn't matter if I get vaccinated or not, we're still shutting down?
No, bottom line is that if you're vaccinated, you will not end up smiling, looking at my smiling face from a ventilator. The vaccines are highly effective in preventing severe illness, being on a ventilator, and dying from COVID-19.
Okay.
Now, why LaSalle did that, I'm not sure. The numbers must be very high. The last thing I want to see is going back to remote learning. But if everyone wears a mask and everyone in college gets vaccinated, I think that we will be in a pretty good place. But, you know, your college kids, hey, whatever. They're gonna...
Let's try to touch on something besides COVID for a second. Not that this is anything good. But I think some headlines have startled people. This Jean-Pierre Adams, French soccer player, he died. Now, he's in his 70s, but he was in a coma for 39 years. This is unusual, isn't it?
Believe it or not, I've had patients with this. It's called a persistent vegetative state. So many people go into comas and they come out of it. Sometimes it's drug-induced comas, can last about 6 weeks or so. But if it persists, then you call it a vegetative state. Now, you want to hear something really scary? Functional MRI scans have found that many of these people are able to perceive.
Wow.
And when I was a resident, we talked about locked in, meaning that they can't really do anything, but they know what's going on.
Wow.
And it's through the love and the care of family members and support teams that keep folks like that alive, despite the fact they are in a vegetative state.
And
I
his
mean,
wife took care of him
wife.
for the 39 years. She was by his side.
One patient of mine, it was the loving mother. It is a tremendous act of love. Tremendous.
Especially over 40 years. Okay. Dr. Mike, we'll see you later this week.
Thank you.
Love you.
Well, this is
Love you.
more bad.